So this is a case study of a patient who had 2 years of biceps tendonitis. And this came on from training in the gym, overtraining in the gym really. So there's a physical overload, and he'd been training about 6-7 times a week. Really fit guy, and normally no issues, fit, healthy, no real history of any problems. And then he developed this arm pain from training so hard that he couldn't do the thing he loved. So what was it about his situation? What was different? He'd seen loads of different people and had it diagnosed, and it was bicipital tendonitis, which is just the kind of bottom end of your biceps tendon. It just inserts in your forearm, and if you imagine doing a biceps curl like Popeye muscle, where that inserts, that can become inflamed. It's called a tendonitis, a tendinopathy. So anything that lifts like that, grips and lifts, tends to hurt the arm. But 2 years this pain was on. He'd had ultrasound scans, he'd had a steroid injection in it. It was more or less said that you're going to have to just manage it, or maybe try a bit more physio. And I saw this gentleman and took his history and asked him what else was going on around the time that he started to feel the pain. And he looked puzzled about that question, because everyone wants to show you, people want to show you their pain, want to point to it and help them work out why it's still there. It's the end result of a lot of behaviours though. It's relevant, and there's some conditioning of that part of the body that needs to happen. There's movement there, there's conditioning of that part of the body to some of the things he wants to get back to. But there's desperation there sometimes at this point after 2 years of not being able to train like that. It's a desperation, and quite often the people just do the training anyway, so it perpetuates the cycle. But why did it happen? So we asked him his situation. There was a huge amount of stress in his life at that time, and not just for a week or two, for months and months and months. He described, he almost said 1 year this was happening, and the second year this was happening. And it was practically either side of when the symptoms started. So that pain that he gets doesn't just magically manifest, but he's hammering a behaviour that makes him feel better. Which is the gym. So you distract yourself from the emotions you feel about the situation you're in, because if you can't resolve that, you can't resolve the feelings you have for it, your body can't allow you to stay like that. You've got to escape it, and we've all got our default for that: work, chocolate, gambling, shopping, exercise, and these small hits we get with these things work, but they don't last. So if there's a time in your life you have to hit them a lot harder for a lot longer, there's a chance that the behaviour you use, if it's destructive, causes a problem in itself, and then the person has lost their down button, their default down button, for when they're feeling stressed. And there's a mechanism in the brain where this happens. So the more stress we feel, it releases dopamine, which should be the pleasure-inducing drug we get from doing a nice behaviour. But actually, once you've got a pattern of routine in your brain, once you've got it programmed that your default behaviour to feel better about yourself, when you feel stressed, those stress chemicals, when it releases dopamine, it doesn't release pleasure. It simply creates a compulsion to do it. So the more you do it, it doesn't actually give you the hit of pleasure. You've got to get more of it. More chocolate biscuits, more work, more exercise, more this, more that, and more of a destructive behaviour to even just feel like you can cope with what you're dealing with. Now that means that in his case, exercise, it became overloading. So once we identified that it was the driving nature behind behaviours that then create the pain simply becomes protective. It becomes so wired to the potential of the behaviour that it short circuits to the pain. So now the behaviour was taking someone towards a sense of safety, away from the stress, but it was a stressful thing that took them away from the stress. It's a paradox. The brain recognises the behaviour as being dangerous at that level, so it triggers pain to substitute the behaviour. So as soon as a person feels stressed, they want to do the behaviour, but it triggers pain. That creates more stress that drives the trigger for the behaviour that's substituted for the pain. It's a loop, and this guy was stuck in the loop long after the event was over. So once you've automated the pattern, the stress around the pain becomes the driver for it, not the event. The event's a long time over. I said, how do you feel about that situation? He said, I'm fine, it's sorted. I said, well, what? Okay, well, we don't need the stress to drive that. We don't need to be stressed about your arm because you're going to get better, but you have to do this, this and this. And you do it like reversing a habit, and you know how to train. And you're going to drop a level below the threshold of pain, and you're going to commit to that. And you'll be completely fine. His pain pretty much changed immediately in the room. It's crazy when it happens like this. It's liberating for the patient because you set them free of the fear. Fear is the biggest driver behind pain. There's loads of other emotions as well you can link it to, but fear is the biggest driver of pain. And when you can help someone lose that, when you help someone lose that fear, you don't have to do a lot more. There's physical conditioning to do. I've got a situational event they've got to go back to, and putting the head in the lion's mouth, then yeah, you've got conditioning for that. But that's a normal response. We all have to deal with stuff, physically, emotionally, psychologically, but we come down and get the balance again. And most people know how to do that if they've not had pain for a long time. Some people have never learnt that, and that's fine, but you can learn it. You can learn it. The pain's just telling you that the balance isn't right. So he did amazing, this guy, really good. And I saw him for 3 or 4 occasions. He's discharged now, but it's such a nice thing to see in someone. And no more biceps tendonitis. It doesn't matter where the pain is. It doesn't matter how it originated. If it's a persistent pain, you can unpick the story behind it. You can reverse it.